This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. It's the fourth day of 2022, and Omicron is crashing the new year. Today, we get the latest on the COVID surge, this variant, and how it's impacting school, work, and life in general. Coming up, we hear from school officials, an epidemiologist, and a Connecticut doctor treating hospital patients. And we want to hear from you. Have you sent your kids back to school? Or how's the hunt for a COVID test going for you or your family members? You can join us 888-720-9677. That's 888-720-WNPR. Or share a comment on Facebook or find us on Twitter at Where We Live. Later, I'll be joined by Dr. Saad Omer, director of the Yale Institute for Global Health, and he's also professor of medicine and infectious diseases, to answer your questions about the Omicron variant and the latest guidance from the CDC. First this week marks the return to school after a holiday break, and that saw thousands of new COVID infections in Connecticut. Many local school districts have reopened, but we've heard from parents and some school staff still on edge. And this morning, Hamden Superintendent tweeted that due to staffing shortages, Hamden High School will be closed today. Joining us first on Zoom is Fran Rabinowitz, Executive Director of the Connecticut Association of Public School Superintendents. Fran, welcome back to the show.
Thank you, Lucy. I'm very pleased to be here.
Now, this note, we also invited Connecticut's Public Health Commissioner, Dr. Manisha Juthani, to join us today, but neither she nor a representative from the State Department of Public Health were able to join this hour. And so, Fran, tell us what your members have been dealing with, especially in the lead up to the return to school. A lot of planning post CDC, this updated guidance. What do you know?
So much planning, Lucy. I mean, we were very much looking forward to the week between Christmas and New Year's as being a bit of a respite, but that didn't quite happen. There was new guidance that came out, and certainly the surge in COVID had superintendents across the state planning how they would reopen, trying to get numbers to determine what type of staffing shortage they would have. They were redeploying staff, and really up until the last minute for some of them, they didn't even know if they could open on Monday. I personally think they did an incredible job of being able to open. The far majority of schools did open. I spoke to many who were superintendents, assistant superintendents were out in the buildings just, manning classrooms in some places.
That's unusual to have central staff in the classroom, yes, as stand-ins for teachers and others who may not be able to come because of a COVID positive test or someone in their household. And so talk more about that patchwork, because we're hearing about staffing shortages, but also on the idea of not even having enough bus drivers to get students to school, Fran.
I think that if I could start with the bus drivers, that was a determining factor in, a couple of districts that I spoke to. I spoke to one superintendent yesterday who was just pretty despondent about having to close at the last minute. And he said up until 11 o'clock on Sunday night, he was in okay shape. But on Monday morning, he realized he had such a shortage of bus drivers that he was just unable to open because there could have been a long delay, and he didn't want an elementary child standing out there for an hour in 27 degrees. So he was forced to close. I have a positive story in New Haven. They were down 52 bus drivers yesterday, but Fairfield had it in their calendar to have schools closed. They weren't reopening until Tuesday, not due to COVID. It was just in the calendar. And they shared their bus drivers from Fairfield with New Haven. And so Dr. Tracy was able to open the schools. I think there's a whole lot of redeployment going on. Their teachers are amazing, and they're covering for their colleagues on their free periods, etc.
So you mentioned New Haven, also Enfield, having issues with busing. That's why they were unable to open. Again, relying on, maybe neighboring districts who have made the decisions to close that then have people to pitch in to drive kids to other schools. Not sustainable, Fran. So are you worried about, this next week when we're hearing, even more cases are expected?
I am concerned. By the way, I'm sorry if I misled you. New Haven did open. They have not closed at all.
But Enfield
yes,
was closed. Mm-hmm.
Yeah, right. They did not close. I am worried, and certainly we're going to take it day by day. I was heartened this morning that there weren't a large number of school districts closed. As a matter of fact, some that were closed yesterday were open today. So that was somewhat heartening to me. But do I think we're on edge? Absolutely. There's nothing that we want more than to have our children in front of us. And I know I'm constantly on the phone with the teachers' unions, and they want that as well, certainly in a safe environment. And, it's just, I think it's going to be day by day, Lucy, right now. And we're just going to have to sit with the discomfort because we're planners. We want to know everything's in place for our students for the next months. And it has been incredibly hard on our school leaders and educators to have to live with uncertainty.
You're hearing Fran Rabinowitz here on Where We Live. She's executive director of the Connecticut Association of Public School Superintendents. Fran, you used the word uncertainty. That's where a lot of this anxiety and stress and frustration that's being felt, not only by school officials trying to do their best, but I heard from many parents yesterday who some were too nervous to send their kids in because of this COVID surge. Others, worried about, remote learning starting again because they've seen how their children have struggled. They don't want to see that option. And so when we think about this next few weeks and months, thinking about remote learning having to be a possibility if there aren't enough staff to be in a school, talk through what the superintendents are thinking about that alternative.
Well, I will tell you that superintendents in Connecticut, not unlike superintendents that I'm hearing, I heard today about Philadelphia wanting to do whatever is possible to keep our schools open and to have students physically there. We know from our students themselves, they have told us how important that is, and from our families and certainly from our staff as well. And so I think we'll do everything possible to not implement remote learning at this point. I certainly think that if it does become a possibility, we're able to pivot to that. As you know, right now, we don't have that ability. That would be an executive order from the governor. And we're certainly at this point in time not looking to move to remote learning. We have the majority of our schools open. Our schools over the last 2.5 years now have proved to be, 2 years, have proved to be the safest places ever. I mean, the mitigating strategies that we're using and continue to use, along with our N95 masks, we're expecting a shipment of home tests to arrive in our schools today. Certainly not enough for everyone, but there will be more shipments coming our way. And we think with those mitigating strategies, I can't guarantee 100% safety for students, but I do think it's one of the safer places for our children to be.
Again, you're hearing Fran Rabinowitz here on Where We Live for another perspective from a school district in Connecticut. Joining us now is Jan Perruccio, who's superintendent of Old Saybrook Public Schools. Jan, welcome to the show.
Thank you for having me. Good morning.
So what plans were in place for your schools to open, Jan? How'd you do it?
It took a village, quite honestly. Similar to Fran's story about what's happening at a state level, at a local and regional level, we spent the week off creating scenarios. Every possible scenario was considered and what actions we would take. And that meant, a lot of regional effort with our health district, our medical advisor, the district leadership team, all the administrators, emergency management, the teachers union. We met with all of these folks, either, by phone or Zoom or Google Meet, and made sure that we were all saying the same thing on the same page and prepared for multiple outcomes. And then, of course, finally, we communicated with families and staff about what to expect, got masks into teachers' hands right away, and even got our bus company on board. So lots and lots of work, lots of building of infrastructure and planning for all possibilities really is what made this happen yesterday.
Tell us about any staff shortages that you're facing and how you're filling that gap. Is there a reliance on substitutes?
What we did is we called all of our substitutes, our regular subs who come in on a very regular basis, and we got them lined up, even when we weren't sure if we had openings. And that turned out to be the best way to go because we ended backfilling using them. We have decided an order how we will pull people from one classroom into another. And how we will use administrators, including central office administrators. I was telling Fran earlier, I'm in my teacher clothes today. And if I end up in a classroom, that'll be a great experience for me. I think it's the best way to go to make sure that teachers and students and families know that we care so much about being here in school that we'll do whatever it takes.
We've spent some time talking about having people in place, but I'd like to ask you more about with this new guidance from the CDC, shortening the isolation period, and the guidance that the DPH, Department of Public Health, has given schools. Tell us your response to these changes, and how you're getting this information to staff and thinking about communicating with parents about this as we see this surge continuing.
It was a significant change to drop back from 10 days to 5 days. And so it took some time for me and my nursing director who worked with me all last week, and even our regional health authority, to absorb the change and to appreciate why that change was being recommended. And then, once we came to understand the rationale, we shared it with families in bits and pieces so that they could process it in the same way, and with staff as well. Really important when a dramatic change like that, is made, that we understand what the science was that went into it. We were just on a call with DPH just before this meeting, and there were a number of really excellent points made about why that change was made. Part of it is logistics, that we don't have testing kits and we don't have PCR testing availability as we would like to. And so keeping students out of school or keeping staff out of work who may test positive for weeks, but have no way, they're not really shedding the virus anymore. That was the rationale behind it as it was explained to us. And when people have questioned it or pushed back on it, I've explained that Old Saybrook Public Schools has followed Department of Public Health guidance and has vetted it with our regional health authority and our medical advisor every step of the way, because obviously I have to stay in my lane and be an educator. I'm not a medical person, and people have understood that.
You mentioned staying in your lane, but you must be hearing concerns from parents thinking about also one of the new changes is that when we think about the amount of time that school nurses and other staff have been working on contact tracing, that's not something that's going to continue moving forward. Jan, what can you tell us?
Well, the happy story there is that we have throughout the pandemic had very little transmission of illness inside our schools. And that's because this is a place where people have been diligent about keeping masks on, and social distancing. Our teachers and administrators have done a great job explaining that to students. Our students had done a great job staying masked, and just before the holidays, students were starting to slip a little, and I can report that they have gone back to being very diligent about their mask wearing again. They want to be in school, they want to play sports, and so they have really done a great job with that. I think for the most part, we've had no transmission in schools. We continue to contact trace here in Old Saybrook, not inside our classrooms where we know everyone's doing a great job, but in those places that are a little bit more high risk, like the cafeteria where students are eating. Also the school buses, where a bus driver is the adult on the bus, and that person is responsible for getting kids home safely and watching the roads. And while they are trying to be diligent about watching students and mask wearing too, that's not always possible. So that's another place we intend to continue contact tracing. But to spend more time on that in the classroom where we were coming up with no close contacts because everyone's masked didn't make sense. We need to turn that attention towards students and staff who might become symptomatic during the day.
Fran Rabinowitz, what are you hearing from other superintendents from different towns related to the contact tracing changing?
Well, I think that superintendents have been asking to discontinue the contact tracing for quite some time now. They have a lot of data that shows that the contact tracing did not amount, for the amount of work that it took, it did not amount to very many positive cases at all. And so they were pleased to be able to move from contact tracing to what Jan just talked about, and that is the, having their school nurses and personnel focus on the symptomatic and making sure that those students are moved out and at home. So I'm hearing relief from most superintendents on the contact tracing.
And what about parents who are concerned about this, Fran?
Well, I think parents need the communication is so important. And even when you think you're communicating well, you have a ways to go. I found that out in many, many instances. And I think that parents need to see that the contact tracing didn't yield protection for their students. And there are better ways that we can work now to ensure that their students are even better protected. I mean, I'm not blaming anyone. We needed to work through this. This is new information, new territory for everyone. But honestly, the data shows that the contact tracing didn't result in a whole lot of a finding of positive cases.
Before we let you go, the Department of Public Health will be having a press conference later this morning talking about this updated guidance. Jan, what do you want to hear from officials, including the governor, related to this surge and how your district and others can be helped?
I would really like them to continue with their messaging and explanation to the public about why these changes have come about, and any clarification that CDC provides, if they can, share that with the public so that they can help us message, what it is that we're doing to keep students safe and how we're trying to strike that balance between, overall health of students and staff and both physical and mental health. And I firmly believe that being in school is a great way to support students and their growth and their mental health. And we certainly saw during school close down periods that there was a significant concern about how students were developing socially and academically. And I don't want to go back to a place where they're not together learning from each other. I don't ever want to go back there again if I can help it. And I'm hoping that what they give us today will support that, support us being in school and give us good language to continue to explain it to the public.
Fran Rabinowitz, who's Executive Director of the Connecticut Association of Public School Superintendents. Again, we heard about the patchwork, some school districts like New Haven pulling in bus drivers from neighboring towns that their schools were closed. And when we think about, this next week, not all parents can drive their kids into school. And so, the challenges that remain as we think about this latest surge.
I do believe that there are challenges that do remain. I don't want to lead anyone down a primrose path. I think we're doing the very best we can. I think we're going to continue to try to keep every school open that we possibly can. And I think the best that we can do is let parents know as soon as we know. And families. I think that is incredibly important. I'm hearing that sometimes I know personally it's very difficult when you hear it very, very close to the time you're planning to have your children in school, that schools aren't open or there's not transportation. So I think we'll do our best to let them know as soon as we possibly can.
And that might be something that the state can work on as well, pitch in a plan when school districts are struggling to find bus drivers, Fran?
Yes, I think the state's been helpful with that in terms of alternate providers. And I think we'll continue to work together to try to find ways to make that happen.
That's Fran Rabinowitz. Also with us today was Jan Perruccio, who's superintendent of Old Saybrook Public Schools. Jan, thanks for your time today.
Thank you.
Coming up, what questions do you have about Omicron and the new CDC guidance on isolating after testing positive? You can join us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Sarah tweets, "We must do more to protect medically vulnerable families. They shouldn't have to choose school versus health, especially when Connecticut hasn't properly protected schools for the surge." She goes on to say, "No HEPA in classrooms because outdated state public health guidelines, despite recommendations from public health experts." Again, we reached out to the Department of Public Health. They were unable to join us this hour. We'll be back after a short break. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. 21.5%. That's Connecticut's daily COVID positivity rate as of Monday, the highest seen in our state as the very contagious Omicron variant continues to infect residents. Hospitalizations have grown to more than 1,400, and officials say more than 6 out of 10 of those hospitalized were not fully vaccinated. So when will Omicron peak, and what's the latest on the CDC's guidance to shorten isolation periods after that positive COVID test? Joining us now on Zoom is Dr. Saad Omer, an epidemiologist. He's a vaccine researcher, also director of the Yale Institute for Global Health. Saad, welcome back to the show.
My pleasure.
Also, listeners, again, can join us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. So I had asked Superintendent Perruccio from Old Saybrook, what their feelings were about this updated CDC guidance. She mentioned, she had confidence in what the State Department of Public Health had shared related to this 5-day, going from 10 days to 5 days. So talk more about this guidance and how it all rolled out, Saad.
Yeah, so CDC started considering shortening the isolation period last month based on the fact that this virus was emerging, this variant was emerging, and there was evidence that there was lower severity per case, although I can go into the nuance that it still burdens the health system and it has substantial consequences at the population level. but also because of its high infectivity, a high proportion of workers would have been out of the workforce. And this includes, for example, people working at water plants or bus drivers, school bus drivers, and so on and so forth. And a lot of us had called for a shortening of the isolation period. In parallel, other countries have taken action on it as well. For example, the UK has a policy of a shorter than 10-day isolation period, provided there are 2 negative rapid tests. So then CDC came out with this policy where this recommendation of shortening the isolation period for very understandable reasons, that, in order to maintain the functioning of the society, they shortened the period to 5 days. But one thing that a lot of us were concerned about, that it didn't come with a recommendation of testing out of isolation, if you want to have a shorter isolation period. And here's the reason why. It's very reasonable to say that PCR tests are very useful for initial diagnosis and otherwise as well, but they remain positive beyond the period of infectivity. So not enough virus. They're sensitive. Perhaps they're looking at the viral RNA, but they're not. After a while, they stopped being a good proxy for infectiousness. On the other hand, there are rapid tests, rapid antigen tests that are actually very reasonable correlates of infectiousness, that at a given time, whether someone is infectious and in that sense is able to rejoin the society safely. So a lot of us, including myself, had a few questions about that nuance in that recommendation, where even rapid tests were not included, unlike the UK, for example. So that's the situation. Having said that, I will say that this kind of guidance is difficult to develop, and it is based on, so it's just like saying that CDC didn't have these tools available when, for 2 years, this country didn't invest in testing and ramping up rapid testing. So at this point, CDC is in a difficult situation based on what happened over the last 2 years.
And when you talk about testing, that's another thing that we're running into, the lack of testing available, Saad.
Yeah, absolutely. Again, a lot of folks have been calling for increasing in the production and sort of thinking through and tweaking the approval pathways for rapid tests. So currently, the way our regulatory system works is that we evaluate these tests for diagnosis, but they serve a public health function as well. It's not just identifying that someone had a virus, and you can sort of take one test and figure out, even through a PCR test, as well as a rapid test. There's a difference in sensitivity, but where rapid tests become particularly useful is serial testing to say that when someone ceases to be infectious. And the other thing is rapid tests are just that, they're rapid. One issue with PCR tests is they're great tests. So I'm not dissing them for their value in sort of getting a definitive diagnosis, and they remain the gold standard. It is one logistical issue is the so-called turnaround time between the test and the result. And so that time to action from a public health perspective, where you say that someone can end their isolation, becomes even more complicated with the PCR test, which again is our mainstay for diagnosis. So these are some of the nuances that a lot of people were highlighting for the last couple of years. And I wish, as a country, we would have had a similar approach that may have required tweaking regulation. We have had large trillions of dollars worth of legislation passed, and could we not have in the past years tweaked our regulatory pathways? Could we not have ramped up, an Operation Warp Speed, if you will, of testing, including home-based testing, to make sure that every American has access to these tests and access at affordable prices.
So when we look at the reality that we're in right now, Saad, when we were just talking with school officials, parents are concerned with this updated guidance, the idea that people can go back to school or to work after 5 days if they're not asymptomatic. How should people feel about this moment that we're in and have confidence in returning to life?
So a couple of things. First of all, we can open schools safely, overall, if you do a certain set of things, and I can come back to that in a second. But to come to your question, one of your earlier guests, the superintendent of schools from old Saybrook, said something very, something that we hear very commonly from people in her position is that it's not their lane to interpret and create public health policy. And so I think from their perspective, following the current policy is a reasonable and understandable path to take. Similarly, in a relatively smaller state like Connecticut, I don't blame the Department of Public Health from not, for not deviating from the CDC guidance. Other states like California, a larger state, has taken the action of adding, at least one antigen test to end your isolation at, as early as 5 days, as part of their policy. So there are sort of nuances to that. I would say if folks have an antigen test available, Connecticut has done more than other states to make these tests available. And there's a serious effort, but at the end of the day, they're working with the overall national supply, and that is an issue because of the reasons I mentioned. So at the individual level, I would say that there are other ways schools are being kept safe. So that gives me confidence. I would say if you have access to, and wherever there is access to antigen tests, again, this is my personal opinion as a scientist, and CDC recommendations do mention that as an option. So this is not a sort of an avoidance of that guidance, but they don't make it a requirement. So if you have availability of an antigen test, use that to make sure that you're not infectious before joining the workforce. So that's where we are at this point threading the needle. There are signs that there is some discussion within the administration and around the CDC for adding more nuance to this recommendation.
When you say nuance, more scientific background and data so that the public can understand the rationale behind the 10 to 5, Saad?
So here's, just to give everyone a little bit of an idea, for those of us who have been doing infectious disease-related research for sort of a few decades, we are used to having a high level of trust in CDC guidance. It's not just because we like the agency, but because CDC has this tradition of, not for all guidance, but for all of the important guidance, to show their work, in the sense they release a scientific document that 99% people don't have to read, but those of us who do this for a living do read that, and including scientists and a lot of practicing clinicians, et cetera, go and sort of read the details in that guidance that provides the rationale, the specific studies, the specific reasoning, and so on and so forth behind an important recommendation. Right now, what we have is a press release that has been revised once, issued to add some clarity, that was released during the holidays. And I understand the reasons for that in a pandemic, to get the information out, to let people know what needs to be done. But I'm just hoping that and on top of that, sorry, to back that up a little, CDC leadership and others have gone to the media to try to interpret, to hint at the kinds of reasoning that they're using for that guidance. But I'm hoping that specific, detailed, scientific background will come out now. So it's okay to get ahead of the situation by releasing the information early. But I think my hope would be that in the next few days, that scientific rationale will be made public.
We're going to continue talking with Dr. Saad Omer, an epidemiologist and director of the Yale Institute for Global Health, coming up. We also are going to hear from a local doctor about treating patients with COVID inside a local hospital and what some doctors want Governor Lamont to do. You can join us as well, 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Got a question about Omicron as cases continue to skyrocket in Connecticut and nationwide? You can join us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. With us on Zoom is Dr. Saad Omer, an epidemiologist and vaccine researcher, also director of the Yale Institute for Global Health. Dr. Omer, I wanted to ask you about mask mandates when we think about how contagious the Omicron variant is. Is this something that it could be a useful tool?
I think it can be a useful tool as long as it's indoor mask mandate. And I think it's a reasonable policy option to consider when these cases are surging at the level that they are. Even if they are milder than before, they are stressing our health system and will continue to stress our health system in the state and nationally for the next several weeks. So I think that's a reasonable thing to consider for at least a short period of time.
Because we're talking about the stress on health systems locally, joining us now on the phone is Dr. Mark Siegel, who is who's pulmonary and critical care physician and residency program director at the Yale School of Medicine. Dr. Siegel, welcome to our show.
Thanks for having me.
We just heard Saad Omer say that a mask mandate would be very useful, especially indoors when we think about this surge. This is something that you and other doctors have been calling for from Governor Lamont. So tell us what you're seeing in the critical care setting and why you believe an indoor mask mandate is needed.
Well, it's a crisis. The hospital is getting overrun. There are many patients coming in with critical illness. We're as busy as we've ever been since the start of the pandemic. It's clear that the virus spreads through aerosols. Patients basically inhale the virus, and masks are an excellent way to keep people safe. So our belief is that if the governor would send out a clear, strong message telling patients or people that they must wear masks, if he were to institute a mandate, we would get this pandemic under control.
When we think about how the state has responded to requests from you and others for a statewide indoor mask mandate, the governor has been worried that that would cause some residents to kind of rebel, and maybe they don't like this other extra mandate on top of some of the other things that people have been asked to do. How do you respond to that? And also seeing that municipalities are putting forth an indoor mask mandate, even though there's not a statewide one.
I think the governor is underestimating Connecticut residents. I'm sure there are some people who would rebel, but there are many more who want to be protected. And the fact that he can't enforce it in every single situation is besides the point. I think when he says that Connecticut residents must wear masks in indoor places, like Dr. Omer is saying, they'll get the message. And this is the strong message that we need from our governor. And I think if he were to do that, I think that we would get this pandemic under control.
You're also a residency program director. When you talk about the crisis that you're seeing inside hospitals, also working with residents, what are they experiencing, Dr. Siegel?
Well, they're the ones on the front lines, along with the nurses and the respiratory therapists. They're the ones who are working with frightened patients, dealing with grieving families. They take it very personally. I think on top of the fact that the infection is so lethal, there's an added layer of frustration now because the majority of the patients we're taking care of are not vaccinated. And in most cases, they were infected due to some preventable circumstance. Now most recently going to parties over the holidays or going to restaurants where the risk of getting the virus is extremely high. So I think it's that layer of dealing with illness, but also knowing that it didn't have to be that way, that makes it particularly hard on the residents and other frontline workers. They're tired and frustrated and doing their very best to take care of the patients, but it's hard emotionally on top of the professional challenges.
When you talk about the emotions, the professional challenges, everyone's wondering when this latest surge will peak. And so can you talk about that and how you and your colleagues continue to do this work in this challenging time?
Well, it's our job. We're called to do it, and if the patients need us, we'll be there. I think that our hope is that when Connecticut residents understand what they need to do to help us bring the pandemic under control, that we'll start to see the rates of infections start to come down. And it's that hope that day will come, hopefully in the not-too-distant future, that helps us get through the day.
You've been hearing Dr. Mark Siegel, pulmonary and critical care physician, residency program director at the Yale School of Medicine. He and other healthcare professionals really advocating for a statewide indoor mask mandate, especially in this latest surge. Dr. Siegel, thank you for fitting us into your schedule.
Thank you. I really appreciate the opportunity.
I wanted to go back to Saad Omer. We were talking about what healthcare professionals are seeing every day, thinking about the many tools that we have, vaccination, masking. Can we talk more about these mitigation strategies and also how the messaging has changed? I was just thinking and hearing and seeing that, there's now a lot of attention on the types of masks that people should be wearing. So many of us wearing the cotton mask, but now emphasis on the KN95s. Can you walk us through that, Saad? Saad, can you hear us?
Yes. So I'm a vaccine researcher for a while, and nothing would please me more than just vaccines being the heroes of this pandemic and saving everyone. And that would be a nice narrative. But unfortunately, we need a little bit more than the vaccines to get this outbreak under control. The long-term solution and the major part of the current solution remains vaccines and now boosters. So keep that in mind, that vaccines are highly protective individually, and there is a little bit of a confusion, at least in the first few months after each dose, especially second and third dose, they do reduce, not to 100%, they do not eliminate transmission. There is evidence they reduce transmission as well. So having said that, when you have a virus that is as infectious, many-fold more infectious than even pandemic flu, and so this is, and many-fold more infections, 2 to 3 times more infections than the original virus that emerged out of China, you need to tweak your strategies. And one of the things that a lot of folks have been talking about is increasing in the 2 years. Remember, in the first month, you prioritize the availability of the masks for healthcare providers so that you can maintain the continuity of operations in the health, in our hospitals, in our clinics, and other facilities. But after that, we had the time to increase gradually the quality of masks, of masks that folks have access to. And that would have prepared us. And now, actually, there is supply in the system, pretty considerable level of supply in the system. It's an issue of access and an issue of education, an issue of making sure that it's, yes, persuading people is another part of the communications effort in public health. But it's the confusion of the willing that is one barrier to accessing the mask. So what kind of mask I need, how to order them, and how to cheaply and easily and quickly get them for myself and my family. These are the kind of questions people have. And so at this point, we need to increase the average quality of the mask that people are wearing, make clear, strong recommendations, associate that, pair that up with a simple, old school public education campaign. And this is not just true for masks, but also for tests, not necessarily persuasion. Again, it's the confusion of the willing that is one barrier. And so that's a low hanging fruit. And then communicate, at least transiently, at least in the face of a highly infectious virus. We need to have a layered strategy. And entities have successfully used layered strategies. For example, colleges and universities in Connecticut and other places have used a layered strategy to keep things under control and to make sure that their main mission and their main function of educating people in person continues.
Saad, we just have a couple of minutes left. I saw a New York Times science writer, actually I heard him say, Carl Zimmer, that Omicron is winning against Delta. More Omicron cases have meant less Delta in the U.S. Is that a silver lining when we think about the severity of some of the illnesses caused by Delta?
It is a silver lining, but with a huge nuance. So CDC CDC coordinated models were released, I think last evening or this morning, that project in the next few months, that project that the wave of Omicron will crest in the next few weeks, and then we'll have a decline. But in that period, they're expecting still tens of thousands of deaths, and according to some estimates, 80 to 100,000 deaths. And so, remember, even a virus that has a case fatality lower than previous variants, and a virus that has lower chances of severe disease per infection, if it happens in large numbers, can have pretty substantial impact, largely in the unvaccinated. And part of our population is a pretty substantial part of our population is unvaccinated. And it will be, even if it's better than Delta in terms of case per severity per case, the cumulative impact can still be something which can be a body blow to our system.
That's an important point when you mentioned those that are still unvaccinated, children being one of them. The CDC and others, even in Connecticut, talking about more children being hospitalized for COVID, Saad.
That remains true. So more than before, children are being hospitalized. Compared to other age groups, the disease remains relatively less severe on average in children, but the increase in hospitalization is a concern for folks and everyone. And so yes, that's part of the story that we need to be mindful of. What is happening is that increasingly, as trials unfold and the data comes out and FDA approves the vaccines and then boosters, the age of vaccination, the minimum age of vaccination is going down. Unfortunately, some of the trials didn't show an effect in very young or sort of under the 5 children. But that's why we do trials. And so they're trying it with a different dose. So there is a little bit of a delay in vaccinating that age group. But that's why it's all the more important to vaccinate everyone else around them.
Saad Omer, thank you so much for joining us, an epidemiologist and director of the Yale Institute for Global Health. This is Where We Live, today's show produced by Katie Pellico. I'm Lucy Nalpathanchel.